Premraj Khairnar. I am a practicing gynecologist at Nashik. Along with that, I am visiting faculty at All India Institute of Ayurveda, New Delhi, since last 2.5 years. My domain of practice is in majority in infertility, and the fashion is fashion of practices of integrative medicine, that is holistically I prefer to practice modern as well as Ayurveda medicine. Along with that, all surgical procedures and gynecological other procedures, along with Sthanika Chikitsa and Panchakarma Chikitsa, which is implied for gynecological practice. I am doing that, and that's it. Thank you.
Thank you, sir. Thank you for sparing your valuable time. I know you are a busy practitioner of gynecology and obstetrics. So thank you for sparing your valuable time and showing up in this August discussion. My next speaker is Professor and Dr. Vishala Turlapati, Madam. Madam, over to you for your introduction.
Thank you, Dr. Arun Gupta ji. Am I audible?
Yes, yes, Madam.
Yeah, it's a good evening, all of you. Dr. Arun ji, Sunita Joshi, Madam, and my co-panelists, Dr. Premraj Khairnar, Dr. Jasmine Gujarathi, and Dr. Asokan, and all the audience who are present here. Good evening to all of you. And at this outset, I would like to extend my sincere thanks for preferring me for this panel discussion, giving me an opportunity. This is really honorable opportunity for me. I'm really honored for being a panelist regarding the discussion on endometriosis. So I would like to extend my thanks to President Govind Sahai ji or Mahesh Vyas ji, General Secretary of this Vishwa Ayurveda Parishad, and also the conveners Sunita Suman, Dr. Sunita Suman, co-convener Professor Sunita Joshi, Madam, coordinator Dr. Amrita Mishra, and other coordinator, of course, Dr. Arunji. So coming to this introduction of myself, I am working as professor and head of the department, Prasutam Prem Sriroga department in Yashwant Ayurvedic College, Postgraduate Training Research Center at Kodoli, Kolhapur, Maharashtra. So I am almost since last 26 years, I am engaged in both academic and clinical expertise. So since last 10 years, more than 10 years, since 2010, I am also PG guide and guided so far more than 50 dissertations, and also presently I am working as a PhD guide also. So clinically, my passion and expertise lies in treating infertility, including all like this endometriosis or PCOS or any other conditions related to both male and female infertility. And also I'm interested, and also my work is done on pre-malignant lesions diagnosis and management part up to the cervical intraepithelial neoplasm of first grade, that is low grade lesions, and also on the Garbhini Paricharya, and protocol of this Garbhini Paricharya incorporating in recurrent pregnancy loss conditions and other adolescent gynecological conditions. Also, I'm more working on those conditions where we need to provide some integrated approach rather than directly either going to allopathic management or Ayurvedic management. My main area of interest and area of work, always I prefer to do the integrated management, because no medical system is a complete 100%. We cannot provide the 100% cure or what you call the relief in present days. So whenever there is a necessity, we need to integrate with the present modern knowledge, including diagnostics and some emergency management, and particularly when it comes to the relief of a pain or relief of a trouble the patient is undergoing, we should not see whether it is Ayurveda or modern. So it's our prime responsibility being a doctor is to help the patient to come out of the problems. So I prefer always integrated management, and particularly endometriosis is such a condition where integration is very much necessary. And while going on to the panel discussion, of course, you will be knowing better that where we can integrate, how we can integrate. So once again, I'm thankful for all the organizers for giving me this opportunity to be one of the panelists. Thank you.
Welcome, ma'am, and thank you, ma'am. Now, I would request Dr. Jasmine Gujarathi, ma'am, to please introduce her. And can we have a look of madam so that all the fraternity members just, interact in a better way with Dr. Jasmine Gujarathi?
Yes, yes. Good evening, sir. Actually, I'm not able to start my camera. I'm extremely sorry for that. Just now, when I wanted to start my camera, it showed that something is wrong. So it always happens with the Google Meet and everything.
Yes, yes.
Antivirus in our laptop, it restricts us to show our face. I'm very sorry for that. So I'm very grateful again for giving me this opportunity to part of this esteemed panel. And though I feel myself very less experienced as compared to the all seniors with me today, Premraj sir, Vishala ma'am, Asokan sir. Asokan sir is my PhD guide too, so I'm grateful to share this panel with him and all the senior gynecologists, our panel who have joined us. And I'm working as professor and head in the Department of Prasuti at J. Patel Institute of Ayurvedic Studies and Research, which is at Anand, Gujarat. And I am having 18 years of experience, and I treat infertility patients more. We know that always challenging patients come to us where they are tired of getting treated elsewhere, and then there is no result, and then at last they come to us, and we find that it is challenging for us. And if we give some benefit of our treatment, then it feels satisfaction from Ayurveda point of view also. So this is my very small introduction, sir. I want to just give this introduction, and thank you all the organizers.
Thank you, madam. Thank you and welcome. Now, I would like to request my senior and very close to heart mentor, Dr. Asokan Vasudevan. He's he's heartbeat of many in IPGTRA. So over to you, sir. So we are not able to hear.
Sir, you're
Sir,
muted.
please unmute. Sir, please unmute.
Dr. Asokan, please unmute.
He is not able to unmute himself.
No, he's a contributor, ma'am.
But he's telling that he's not able to unmute. Sir, can you type in the chat box? No mic option shown.
Okay. Let me check, ma'am. Sir, just give me a minute. I try to fix it up. Sir, please, now you can unmute yourself, sir. Sir, I have made you co-host. Now you can unmute yourself, sir. Sir,
No,
can
sir.
you rejoin? Sir, can you rejoin the call?
Yes. Thank you. Am I audible now?
Yes, sir. Yes, sir. Yes, sir. You are.
Yes. Very good evening to one and all. And at the outset, myself, Dr. Ashokan, Professor and Head Department of Prasuti Tantra and Stri Roga at NCT Netra Chikitsa Ayurveda College, Ameli, Gujarat. I wholeheartedly extend my heartfelt pranams to all of you for who are working with a great motto of making the Ayurveda as a mainstream medical field in India at least and in abroad also by 2047. The Vishwa Ayurveda Parishads and all its office bearers on this occasion, and we are at the holy step into the Shravan Mahina, and with this great enthusiasm and the period of holiness, we are here gathered for the purpose of discussing on an burning issue in the field of Ayurveda as well as medical fraternity, that is endometriosis. So I have a brief, very small period of experience of 18 years in the field of Ayurveda in this life. Maybe we don't know Punarjanma. If it comes, we will extend our experience also over the life period. So, my hardcore effort is to make studies of Ayurveda Samhitas by hearting, so that even if by imprisonment in the Manas and the Atma, let us get another life for learning Ayurveda. So that is my prayer. At the same time, I am extending my heartfelt thanks for the organizers, especially Arun, who has elaboratedly told many things at Upama Kalidasasya, we can say. So, so much of Upama he has told. Let it be. I am thankful for that. At the same time, we look forward for our Guru Parampara, from whom we have inherited the knowledge. So, keeping all those things in mind, we have a very brief PG, PhD guideship programs, and we very small experience in our lifetime. And every day is a example, or every day is a field for us to learn. In our brief period of experiences, many a times we come across people with endometriosis approaching an Ayurvedic consultant for the purpose of avoiding surgeries. So in my experience, a few such experiences are there, case 1, 2, 3, 4, like that. So in that, I have some, I could manage those who are seeking fertility, those who are not seeking fertility. So that is the brief period of patient exposure, as well as we learn from the experiences which we gain with the interaction with the patients. So keeping those things in mind, I am just a sevaka of Ayurveda, and guideship of PG, PhD, all those things are there. So keeping all those things in mind, I'm thankful for this platform, and I hope we can discuss with the questions which may come up across us than telling much things about ourselves. Thank you. Over to you,
Thank you,
Arun.
sir. Thank you and welcome. And with this galaxy of stars from Prasuti Tantra and Sri Roga, let's start with our today's panel discussion. My first question to Dr. Premraj is, sir, what actually do you think is endometriosis?
Yeah.
Enlighten us.
Yeah. Am I audible?
Yes, sir.
Yeah. So basically, as the name suggests, it is this endometriosis term shows something manifestation or pathology with endometrium. If I can see, there are many practitioners and faculties and students as well. I would like to elaborate this term in detail. So if we go actually by the definition, the endometriosis is called as the condition where the presence of functioning endometrium, that is glands, and stroma, these two are the essential components of the endometrium. When they are present in sites other than uterine mucosa, it is called as endometriosis. So simply, endometrium outside the uterine mucosa is called as endometriosis. As all we know that it is not a neoplastic condition. That means it is benign condition, but certainly there are some chances that this condition may convert into malignant situation, but the incidence is very, very low. we do not see very oftenly endometriosis converted into malignancy. But yes, definitely there is some potential in this disease to get converted into malignancy. Now, this endometriosis has two angles or two facets, like interna and externa, where the ectopic endometrium is present inside the myometrium. That means the disease is restricted inside the uterine body or myometrium of the uterus. It is called as endometriosis interna, or very famously known as adenomyosis. So adenomyosis is again the presentation of endometriosis limited up to the myometrium, but it is not again a malignant condition, it is benign condition. Now coming to the externa part, most oftenly the tissues are found outside other than the the uterine cavity or uterine organ. Then these are called as endometriosis externa, and they are purely referred as endometriosis. So day to day we see these both kind of reports and patients day in day out. Endometriosis and adenomyosis are just having the variation in between the places. This endometriosis is having characteristic feature of invasion. So this disease is a progressive disease. It protrudes organ by organ, layers by layers, and goes deeper and deeper into the adjacent structures wherever it is present. And it has tendency to disseminate widely. So it can go and implant somewhere else focally and can regenerate this disease at other places. Along with that, if we see the cyclic hormones, they stimulate the growth or abnormal growth of these ectopic sites. So if we consider a cyclical pattern of a natural menstruation of 28-30 days, every time whenever the endometrium will bleed during the first 4 or 5 days of menstruation, the other ectopic sites will also tend to bleed. But they will not only bleed, they might bleed very scantily, but they will produce a significant pain and other inflammatory symptoms at that places. So cyclical hormones always do progress the disease, but it is very ironically, if we give these hormones continuously, so it makes the suppression of the disease. So these are some characters of endometriosis altogether. I hope most of the part is clear. Thank you, Dr. Arun. Dr. Arun, over to you.
Sir, thank you, sir. Thank you for your views on this, defining what is endometriosis and how it is different from adenomyosis. Thank you for that. My next question to our second panelist, Madam Vishala. Madam, what according to you are the risk factors, or what we say as epidemiology in terms of age, in terms of prevalence? How do you see endometriosis as an emerging gynecological issue? Hello, ma'am. Am I audible, ma'am?
Yes. Am I audible?
Yes,
Yeah.
yes, ma'am.
Am I audible? Yeah. Thank you for the question. So coming to the epidemiology and incidence, the FOXI and ICOG guidelines that indicates adolescent girls between 13 to 19 years. The two groups have been made, one adolescent and the reproductive age. So 13 to 19 years, age 3 to 5% worldwide constitute for the endometriosis occurring. And generally in this age group, almost it will delay 6 to 8 years for the diagnosis, because generally it will be misunderstood as a simple dysmenorrhea. And 10 to 15% of the women of reproductive age, almost with a prevalence of up to 70% with chronic pelvic pain, end up in diagnosing this with endometriosis. And for this reproductive age group also, it will take almost 4 to 11 years period for confirming the diagnosis, because the same case is applicable that most of the time it is unless and until there is a fertility issue that comes in the reproductive age. Generally, the woman who is suffering with endometriosis does not take it seriously. And the gold standard, as everyone knows, is only laparoscopic diagnostic procedure. So generally, it will delay almost 4 to 11 years period to get it diagnosed. And according to the World Health Organization, that's different data. Almost it is equal only, but 10% of the reproductive age women globally are diagnosed with this condition. And peak age of the patients in this time frame is between 25 to 45. So overall, we can consider around 20 to 45 years age as the highest incidence age of this getting diagnosed. Not suffering. Suffering might be there from puberty onwards also, but getting diagnosed will be around this age group. And coming to this risk factors. So if we consider the risk factors to develop the endometriosis, we can consider it right from the intrauterine period also. So there is a research that has been conducted on the intrauterine factors that are affecting the probability of occurring the in the adult life, complaining with the or diagnosing with the endometriosis. One is exposure with the diet ethyl stilbestrol. Of course, nowadays we won't see much of the cases exposed to DES, because in almost in 1960s and 70s, it was a medicine which used to be given for recurrent pregnancy loss and to improve the endometrial thickness and to treat the threatened abortions, etc. conditions. It is a synthetic estrogen, DES, and women used to be given to combat this type of problems. So intrauterine exposure, particularly if it is a female fetus, then it can result into the development of endometriosis. So this one of the study in 2012 meta-analysis have proved this one exposure of DES. And other one risk factor, if you consider in the early adolescent period, early menarche is one of the most prominent risk factor. And second one is those who have very early cycles. If any girl is suffering with early cycles along with early menarche, that is a potential risk factor. And also if a girl, when it comes to the epigenetic and genetical factors, some studies like 2010, there is a study that has been done regarding the hereditary possibility and genetical predisposition of developing endometriosis. So certain studies are proving that there is a probability of in first degree relative running the probability of this endometriosis. Like for example, if the mother is suffering, then the child can also suffer. If grandmother has suffered and aunt's first degree blood relation, if they have suffered, that can recur in the next generation also. So a meta-analysis in Prospero, which was published in 2012, is indicating that there is a probability of these genetical factors, and epigenetics nowadays is gaining a lot of importance, like along with the genetical factors. Epigenetics matlab, like when we are exposed to the environmental factors, it may be due to diet, it may be lack of exercise, lifestyle, and nowadays we can see that lot of altered lifestyles are seen in the adolescent as well as in the reproductive age group. So these all epigenetic factors which will hamper the hormonal status of the body can develop into endometriosis. And of course, there are a lot of theories. I think the question next goes to the etiological theories. But these factors like early menarche, frequent regular cycles, and some of the epigenetic factors like diet, lack of exercise, environmental factors, intrauterine exposure of DES, these things can become the high risk factors. So this is the risk factors in the epidemiology we can consider. So over to you, Dr. Arun.
Thank you. The highlight is Garbhasanskar and Rajaswala Paricharya, because as madam has highlighted that, it starts with the onset of menarche. It has a very high incidence, so Rajaswala Paricharya is very important. So now my next question to our next panelist, Dr. Asokan. Sir, please enlighten us on the Ayurveda aspects of endometriosis. How do you view endometriosis in Ayurvedic parlance?
So in Ayurveda, if we consider, we have to consider it no direct vyadhi as such by name is mentioned. So vikara nama akushalana jigniyat kadachana nahi sarva vikaranam namato asti dhruva sthitihi has been mentioned as the textual reference for that. So if we keep that textual reference in mind, now we have to work up with the dosha dominance. So keeping the dosha dominance in our mind and the artavaha sroto vikara, we can consider the samanya nidana of the yoni vapats as one of the basic causative factors, and the underlying dosha which we have to analyze is srotas and dosha. So we have to consider it as the vata. Nahi vata drate yonir narinam sampradushyati. Ato jitva tamanyasya kuryat doshasya bheshajam. So primary importance has to be given to the overall functioning of the vata. If we consider vata as a dosha, then we have to consider it. How will you identify that? Next question comes is, how will you identify the dosha? So identification is tatra ruksho lagushita kharas sukshmas chalo anilaha. So basing on the guna, we are identifying vata dosha, especially because dravyataha and karmataha. Dravyataha identification is difficult. So karmataha we can identify, and gunataha we can identify. Guna karmataha we can identify the dosha. So keeping that thing in mind about the vata dushti and the role of vata in the normal menstrual pattern. That is, one is dhatu poshana before the menarche, and at menarche, the dhatu poshana. So we have to consider panchavida vata and pachaka pitta as responsible factors, and shleshika kapha also. So all the kapha are sub quotients of the kapha, especially the bodhanat rasa bodhastaha, so rasanasthai. So all the kapha varieties we can consider basing on the gunas of the doshas. So keeping those things in mind, because rasa is kapha varga, so keeping those things in mind, we have to move ahead. So poshana. So from the agni and the vata, which is responsible for the portion of the rasa, so improperly, so yesha prakriti punarato vikriti is the rule of understanding a disease, which when it is not directly mentioned. So keeping those things in mind, we have to move ahead that the prakrita avastha of menstruation, formation, rajaswala, the what we say as rutu chakra, proper rutu chakra, if we consider normalcy, rutau bhavam artavam. Here the artava word is termed from the rutu udbhavata. So that is, it is in a cyclical pattern. So rutu, the word that which is anartavam. So the word anartavam in Ayurveda not only incorporates the menstrual bleeding and ovulation and anovulation, but it also incorporates the seasonal occurrences of things in the environment which is not seasonal. So for example, we are not supposed to drink the rainwater, which is anartava. Anartavam cha yadivyam. They are telling that it is not suitable for drinking. Artavam cha yadivyam is suitable for drinking. That is told in Ayurveda as such. So here, keeping that thing in mind, that which is in a cyclical pattern, the seasonal variation. Because of desha and kala, the deha desha, there is an onset of puberty onset changes. So keeping that thing in mind, the physiological onset is occurring. And similarly, we have to consider the pathology. Here the dosha is predominantly vata, and all the three doshas are involved because improperly formed artava is responsible for improper movements. So shukra artava shakaran mutra garbha nishkramana kriya is the function of apana vata. So apana vata, particularly the dushti hetus are mentioned in vatarakta chikitsa in Ashtanga Hridaya, which says that apano ruksha gurvanna vegadhatati vahanaihi yana yanasana sthana chankramadyesha peditaha. So kurte vikara. So whatever the vikaras are going to happen, that is because of apano ruksha gurvanna vega aghata ati vahanaihi. Whenever we say that vega, it is vega dharana and udirana. Aghata udiranaihi vega aghata Ativahanaihi yana yanasana sthana chankramadyesha peditaha. So whatever sitting, sedentary life, excessive movements, Both are Vata Prakopaka or Kapha Prakopaka and Avranajanya Prakopaka. So either it is Kevala Dhatuja or Avranajanya. And Gati of doshas. So Gati of doshas, Urdhva Adakti and Tiriyak is a fundamental thing. And other Gatis are Koshta, Shaka, Shaka to Koshta, and all the Gatis are being mentioned. So keeping those dosha Gati in our mind, here the dosha Gati is responsible for taking the endometrial tissue in Ashayapakarsha Gati. There is a debate on that. I would like the senior members in the panel to discuss on that, Ashayapakarsha Gati. So because I'm not fully satisfied with my postulations. Otherwise, we can discuss in follow-up period also. The thing is, the movement of Vata in the Pratiloma Gati, Urdhvam Neetam, Udanaha. Udanaha is Udanaha. So Udana is Udana because it takes Udano Urdhva Gati. The Gati of Udana is Udan Pravritti is Udaka. Udaka, that which moves, the Jala which is moving towards the upward direction is called as Udaka in Ayurveda or in our Shastra. So Udan Pravritti is occurring or reverse direction, Pratiloma Gati of Artava is occurring, because of which the various postulations we can understand contemporarily as the spread of the endometrial tissue into the other places, other than that of the functioning endometrium, that is Jinda hai, wo mar nahi gaya hai, wo Jinda hai, or they are functioning abnormally. So presence in other than the uterine cavity. So that in the endometrial layer. So this mind, the fundamental of the dosha and dhatu and the artha sroto dushti and apanavata in particular and tridosha dushti, we have to consider basing on the lakshana samprapti, we have to consider various other things also. I hope that we can discuss later in subsequent questions, if I am okay with the answering.
For sure, sir, we will keep a discussion on this topic continued. Now, my next question to Dr. Jasmine ma'am. Madam, as it involves endometrium and myometrium, so what is your perspective in Ayurvedic parlance, how endometrium and myometrium can be defined?
Yes. See, both the structures are in the Garbhasaya itself. So we know that Garbhasaya is involved for the menstrual cycle. But if we see, endometrium is a very active part. It is taking a very active, and throughout the 28 days or 30 days, continuous changes are going on in the endometrium, and that too in the functional layer. The basal layer remains intact. We need that the what we say, the upadhatu, what is being formed, it is the basal layer, and the functional layer which sheds continuously, and this is very active, we can say. But myometrium, if we say, it doesn't go the such frequent changes. Only Vayu is the one of the dosha which gets more, we can say that it is involved more in the myometrial activity, because it's a masa dhatu. Okay, it's a muscle. So the myometrium is more involved in the process of artava nishkramana and even garbha nishkramana, because totally it's a mass dhatu involvement, whereas rasa rakta, that is and upadhatu is the involvement in the endometrium. And as sir also said that vayu urdhva magatam, so all this is happening in this endometrium. It is happening in the endometrium, not in the myometrium. Of course, Vayu is also affecting that. But as I said, the live or activity is more happening. The gamanatva is more of the endometrium. So that itself goes elsewhere and gets implanted. So this we should understand that, of course, when it implants itself in the myometrium, as Khairnar sir said, it is the adenomyosis, what we call. But there also it remains there itself, and periodic endometrium again, which becomes live over there, periodically sheds itself during the shedding of the menstruation and there. So endometrium is a very live and active throughout, and this myometrium remains stable. But according to the Ayurveda, if we want to say, whatever rasa rakta involvement of dhatu is there, it is in the endometrium, and masa dhatu we will call it is the, which is stable, it is in the myometrium. So whenever we want to treat this condition, we should take into consideration the role of the dhatus involved and even the doshas which are involved. So that is why if we go further in the pathogenesis also, sir has also mentioned, Asokan sir also, that pathogenesis mainly is the Vayu, Vimargagaman, Pratiloman. So understanding the involvement of Vata dosha in the endometrium as a Rasarakta and in the myometrium also, that will be the proper way to understand and then diagnose and then even treat this condition. We will come later on in the treatment aspect also. But this is what I understood from the Ayurveda point of view, that endometrium is a very active layer of the uterus, Garbhashay. Garbhashay as a whole we take from Ayurveda point of view. But in that also, the active participation is of endometrium, and the myometrial layer is the second. That is what I understand, sir.
Thank you, ma'am. Thank you for your valuable insights. Now, my question to Dr. Premraj. Sir, there are so many theories of endometriosis. How, we can corroborate the different theories, and what should be the guiding theory in management of endometriosis?
Basically, the pathogenesis or pathophysiology of endometriosis is based on theories, and there are predominantly 3 theories which are quoted, and each theory is relating with the site of the disease progression or site of the we can say disease occurring. So sites and theory, they are interrelated. When we think about pelvic endometriosis, that is the basin of the pelvis is affected by this disease, then the theory implied is retrograde menstruation, that is called as Sampson's theory. Then when the pelvic peritoneum is involved, then it is called, or it comes under the theory of coelomic metaplasia, that Mayer and Ivanov theory, that is what we call it as. And very routinely nowadays we are seeing explicitly increasing cases of abdominal scar and episiotomy scar, and they are the effect of direct implantation. That was the third theory has come into progression. It is direct implantation. So we have 3 theories: retrograde menstruation or Sampson theory, coelomic metaplasia, that is Mayer or Ivanov theory, and direct implantation theory. So we'll see one by one. So when we consider retrograde menstruation, it is said that every month the lady is having menstruation, the blood flow will continue for 3 to 5 days or 7 days invariably. And in older days, it was considered that this menstrual blood flow should go downside, obviously, but it was considered that abnormally it goes upside or retrograde, and that is how it creates the disease. But nowadays the science has changed. We have to think very, very logically. I will come to a next point, that if we see retrograde flow of menstrual blood to the uterine tubes will go and implant the disease. This was the older theory. If we consider that, then there are some questions. If the cells which are coming from the deported or departed endometrial epithelium, blood clots or blood cells and some debris, whether they are actually eligible to produce the disease, this comes first. So many people challenge this theory on the basis that the dead cells cannot produce the disease. This is very important thing. No doubt the debris and the clots, they can produce some occlusion into the tubal sites, but the potential of these cells to produce disease is always in a great incredibility, right? Second thing, some people say that some endometrial fragments get implanted in the peritoneal surface of the pelvic organs, and that is how they produce the disease. That means they are seeing some fraction or part of the epithelium it is implanting, but science itself do not support all these things very directly. Then cyclical growth and shedding of the endometrium at the ectopic site occurs under the influence of the endogenous ovarian hormones, that is estrogen and progesterone. This is one theory given under the Sampson's theory. This one point is given. Again, if we see when the cells get cut off, it is almost we are in the late secretory phase. What happens actually into the late secretory phase, that the cells undergo degradation or degeneration. Sometimes there happens some phagocytosis as well. The microvessels become more and more crumpled, and they tend to slough off with the clogging and initially bleeding and then clogging mechanism. So whatever it is coming, it is devoid of all these hormones. If we go in detail, estrogen has a different cycle, that estrogen receptors which are present inside the endometrium, they are of two types, ER alpha and ER beta, that is estrogen receptor alpha and beta. This estrogen receptor alpha has a very high occurrence, or the magnitude of these receptors is very high during the initial phase of proliferative phase of menstruation. But they eventually they decline after ovulation, and immediate after ovulation they decline to a great number. That means these cells are devoid of estrogen. When these cells are devoid of estrogen, though this theory quotes that these cells migrate and implant some other place. Now friends, consider, you just make one point very clear. It has been profoundly proved that the endometriosis has local estrogen release of the tissues, whatever implants are there. So estrogen should be the functioning key factor or hormone in these ectopic sites. But if the cells which are being carried through the menstruation, they are devoid of these estrogen receptors, and ultimately the receptor, the estrogen hormone, then it is very unlikely to implant these cells and growth. Again, when we think of Ayurveda, according to Ayurveda, this is Rajasrav. I personally consider Raja Dhatu and Rajasrav in two different conditions. Raja Dhatu, in my view, is sanchit of Rasa Upadhatu inside the Rajo Vahagata Sira. That means the arcuate vessels parallel to the radial arteries, arcuate vessels, radial arteries, and spiral arteries. The blood which is present during the proliferative and early secretory phase is called as Raja in my view. Okay. Along with that, the epithelium which is in contact with these blood vessels is Raja. And when the debris comes out or the menstrual flow comes out, it should be considered as Rajasrava. Sometimes Granthakaras have stated it as Artava and Raja. So till today, we are not able to confirm what should be called as Raja and what should be called as Artava. But we have to again think in context. Sometimes some Granthakaras has quoted the menstrual flow as Artava and some has quoted it as Rajasrava. So I personally thought in this context as Rajasrava, Raja and Artava. So Raja is the Dhatu which is present at that place, and Rajasrava or Artava you can say simply Artava Vimukte. So Artava we can consider as Rajasrava or the menstrual flow in this context. So Ayurveda also quotes that the Jivan or Punarujjivan is from live cells and it is not from dead cells. So whenever new implantation and new growth is expected, I do not think that this Sampson's theory stands very firm for the development of ectopic sites. But and even in modern medicine also, it has failed to explain how the actual retrograde menstruation causes implantation. This was first theory. Now we will come to second theory. Second theory is coelomic metaplasia. Coelom means cavities. Metaplasia means transformation of the cellular epithelium from one phase to another. But definitely it is benign. It is not malignant. It is a part of physiological procedure sometimes. When it becomes pathological, it may convert into malignancy. So coelomic metaplasia is also known as Mayer and Ivanov theory. It has two angles. Again, chronic irritation of pelvic peritoneum is there. That is the what we can say Sthan Samshraya according to Ayurveda. And trapping of Mullerian tissue remnants during the development of that particular female is the main reason behind this theory. So we have oftenly seen that many females, they do not have this endometriosis since birth. Even in developmental age, they do not have, and some ladies uh, manifest it after some period of adolescence or adulthood. So we have not seen each and every case essentially should having the Mullerian remnants at that places. Okay, and the this theory explains the covering a matlab the area where the manifestation occurs is abdominal viscera, rectovaginal septum, and umbilicus. Now, if we have to think on this theory, coelomic metaplasia can be considered on various biochemical components. Nowadays, they have been found what we call it as biomolecular pathology, what we see. So in detail, I need to explain to share the screen. Just it is very interesting thing. You can consider. I'll just share my screen. Oh, just. Is the screen visible, Arun sir? Hello, Arun sir.
No, no, sir, not yet.
Okay, so just a minute. Yeah. Now is it visible?
No, no, sir, no.
Just a minute.
It can be seen, sir. It is visible to me.
It's visible.
Yeah.
It's visible.
Now is it visible?
Now it's showing, sir.
It is visible, sir. We can see.
Yeah. Okay. So I have already drawn a picture of uterus, endometrium, and the tissues depicting the endometrium in detail. As already ma'am has explained about the endometrial layers. So there are two basic layers, that is basal cell epithelium and functional epithelium. So I have drawn the basal cell in green color and the functional endometrial cells in red color. Now there are certain things that this is very we can say characteristic endometrium inside the body. It always, the endometrium always remains dynamic. How it is different from other mucosal layers from the body, that there is transformation of basal cells into the functional endometrium. So basal cells are some kind of, you can say, stem cells which get transformed into functional cell layer. Now the interesting part comes here, that if we see the nowadays the research has quoted that there are 2 or 3 important biomolecules which are present inside the cells. So there are integrins, what we can see, integrins, and and what we can see is E-cadherins. So E-cadherins are the second molecules what we can see. Okay, so integrins are nothing but these are the biomolecules which help to implant the embryo into the endometrium, and the endometrium gets converted into decidua. These are the integrins. But when we see the functional layer, these 2 functional cells, if we consider, the E-cadherins are there, right? So if we consider these 2 cells, these 2 cells, they have been adhesive with this E-cadherin. Okay, so adhesion in between these 2 cells is E-cadherin. Now the current research suggests that there are many ladies who are lacking these cadherins within the epithelium of the endometrium on their own. The reasons are unknown, but again, as Dr. Vishala ma'am said, the epigenetics plays a very important role. and Rajaswala Paricharya observation plays an important role. That is what I can quote in this subject. So E-caderins are lacking. The E-caderins causes to departing these live cells and migrating these live cells from here to other directions. Okay, so each cell will depart, but this will happen before menstruation. That means in late secretory phase. The menstruation will not be actually started, and these cells will migrate into different directions, and these cells which are having live estrogen inside them and the cells are alive, these cells will migrate from one cavity to another cavity. That means they will travel here through the fallopian tube into the peritoneal cavity, and they will implant into the peritoneum. This is how, this is transcelomic migration of these live cells, and this theory, I believe it is a strong theory that we can believe, and it is evident by many clinical trials or some studies which are carried on mice. So, and second thing, when we consider some Ayurveda aspects, this again supports the theory. Ayurveda says that Vegad udavartad yoni udavartad anilaha. So as Asokan said, very rightly said, Vayu is behind all these things. Sarugarta raja kruchanat uluttam vimuchyati. That means when these lively cells transmigrate into abnormal sites or ectopic sites, the place is abnormal for them and they grow there. How they grow? Because they have the characteristic of some stem cells or which were they previously progenitor cells. They develop as functional cells and they develop endometrium outside the normal site, and that is why they produce the menstrual symptoms at that ectopic sites, which attract many cytokines. So cytokines like TNF alpha, then interleukin 1 or VGEF, that is vascular endothelial growth factor. Now VGEF, the name suggests it is reasonable, it is reasonably producing the microvessels. So endometriosis has stromal tissue, glandular tissue, these microvessel, and that is how the patch of the endometrium is produced. And this patch may get converted into chocolate cyst when it grows on the ovary and it gets enclosed by a capsule. Then we can say it as endometrioma, and it may get spotted onto bladder, then rectal wall, then peritoneum. So this theory implies very nicely, but it is in, we can say, pipeline. But nowadays the world or the scientific world is believing on this theory, which is not quoted in books right now, but very soon it may come. Now the third theory is about direct implantation, right? So direct implantation is nothing but, again, when we see these cells, these live cells which are in the form of deciduous. See, direct implantation mostly occurs during the pregnancy delivery, like vaginal delivery or abdominal cesarean delivery. So when this decidua is attached to the surface of the fetal body or hands of the surgeon, then these cells are transmigrated through the vector of fetal body surface or hand of the surgeon, and they get implanted into the other body surfaces like fat of the abdominal wall, rectus sheath of the abdominal wall, muscle layer of the abdominal wall, or you can see even subcute tissue of the abdominal wall, and there they grow and there they produce characteristically the stromal tissue, the glands, the VGEF, they produce network of vessels, and this is how the patch of endometrium which is abnormal is produced into the scar site, and that is how the scar endometriosis is produced during LACS. Now same thing happens into the vaginal delivery. For vaginal delivery, we for facilitation of easy fetal head delivery, we put a deliberate scar on the episiotomy scar or into the perineum, that is called as episiotomy scar. This episiotomy scar is also vulnerable to get attached these cells during the fetal head or body delivery, and there are very rare cases where we can see the direct implantation into the episiotomy scar as well. So this is how the direct implantation happens. So these are the three theories what I can postulate. The important part I wanted to focus is why the second theory of coelomic transmigration is very important, because in the next shloka they say that artavesa vimuktetu tat kshanam labate sukham. That means whenever bleeding will start, the pain will go down, because the process of preparation of menstruation is really painful, and prostaglandins are released up to the menstruation. Once the flow starts, the prostaglandins goes down. So once the menstruation starts, whatever trapped inside this complex tissue complex gets released, and that is how the artavesa vimukte happens. That's how Ayurveda has quoted it very nicely. But rajaso gamanat urdhvam neyo udavartini bodhe. This is how Sushrutacharya has quoted into udavartini yoni vapan. Rajaso gamanat urdhvam. So raja is again not the menstrual flow, but it is the upasanchita raja or the endometrium that transmigrates, which is lively. So this is how what I can put my view on this theory. Hope you, all of you, will definitely think on it and you may like it. Over to you, sir. Arun sir.
Thank you very much, sir. For me, it is a master class, as we are learning from the masters. All I can, all I can integrate is, all we can reflect is, it is one of the vikriti of dhatu vyuhan karma of Vayu, which causes all this mishap in the structural aspect of ovaries. Ma'am, Vishala ma'am, now my next question to you, as we as Dr. Premraj has elaborated his aspects on this endometrium. So how do you see which theory is the most applicable in the clinical context, and so far as the management of this condition endometriosis is concerned? Ma'am, your insights.
Yes, the very beautiful explanation on different theories by Dr. Premraj. So even like when we see the theories, I'm not going to repeat what sir has told. The same concept that Rajaso Gamana Durdhva and Artavasa Vimuktetu Takshinam Labate Sukham, these both reflect towards retrograde menstruation. So whether we consider it as a menstruation or some in forms like acute retroverted uterus, and in such conditions, this retrograde menstruation would be a contributing factor for the development of endometriosis. Like that, benign metastasis, all have been explained by Dr. Premraj, but I wanted to focus on one important point, that is immune dysregulation, because he has already explained coelomic metaplasia, endometrial cell recruitment theory, hormonal imbalance, etc. So let us concentrate another important point. All these conditions, for example, coelomic metaplasia may be seen in many. Metaplasia is a common factor. It can occur in many females, and retrograde menstruation also, like for many females, may be having as a normal phenomena retroverted uterus. And these conditions, but why each and every woman is not getting affected with endometriosis? So there comes the immune dysregulation theory. So this we have to focus more on the immune status, which is working adversely in a particular female, which because of this, these conditions like endometriosis develops because of this immune dysregulation. So what happens in this immune dysregulation, where the immunity affects the clearing of this debris, what we call, whenever there is a deposition of this ectopic endometrium, or when the endometrium is reaching because of many circumstances, when it is reaching to the ectopic side, what is making the development of the ectopic endometrium in particular person or particular women? So it is endometriosis is well said that it's an inflammatory condition. So the most common factor that we can attribute is immune dysregulation, which is one of the main mechanisms that takes part in the disease, where here the cell proliferation and infiltration occur, And particularly in case of endometriosis, the pro-inflammatory pathways, that's these cytokines, neutrophils, natural killer cells, dendritic cells, and T cells, etc. These are pro-inflammatory pathways where these pro-inflammatory pathways, this particularly when there is a dysregulation of immunity, this will block the function of apoptotic mechanism. Apoptosis means the self-destruction of any abnormal cell, or even, of course, natural cell also. The own death of a cell we consider as apoptosis. So these pro-inflammatory pathways, when there is excessive release of the cytokines and failure of the natural killer cells to control this development of these cytokines and infiltration with the neutrophils, these all comes under pro-inflammatory pathways, and these inflammatory pathways block the function of apoptosis. So naturally, this potential failure of this apoptosis will make the harmful cells adherent to the distant sites. So that is what we call the ectopic development, and the immune cells involved in formation and further development of the endometrial lesions. This failure of the immunity regulation itself is a major factor, what I feel, because when we in the retrospective judgment of the cases what we treat, the adding of a rasayana in the treatment will definitely make a lot of difference in treating the endometriosis conditions. So this theory also will help or will support that immune dysregulation, or when we consider it in the Ayurvedic concept, that is nothing but the circulating ama, the circulating endotoxins which make the immune dysregulation. And of course, again, when we go back to the theories, Midyahara Vihara, this Pradushta Artava, these all cause this condition of any yoni vyapat, because endometriosis we cannot consider into one condition. So we have to include yoni vyapats, particularly Vataja yoni vyapat, Artava vyapat, because Pradara is also, menorrhagia is also included in this condition, and some conditions like Vamini yoni vyapat. When we say recurrent pregnancy loss because of the failure of implantation. So this also, and of course, infertility is one prime factor in endometriosis. Vandyatva. So many conditions in Ayurveda can be understood as endometriosis. So for this, all this causative factor is basically Midyahara Vihara, we have already discussed in the exposure to the epigenetic factors, and Pradushta Artava. Any type of Artava Dushti can also lead to this development of these conditions. And while dealing with the Vataja Yoni Vyapat, Chakrapani has given one important point, that is Anruta Artava. Anruta Artava is nothing but some ectopic only, which is a false one. Anruta is which is a false one. So Anruta Artava is establishing or developing a false Artava somewhere, or ectopic endometrium implant we can understand. So this all happens when there is a failure of immunity or immune dysregulation. So this theory is strongly proposing for the development of the endometriosis, because many conditions may be present in many women, but when there is a failure of this endometriosis, when there is a failure of this immunity regulation, then definitely the development of the ectopic endometrium will be more prominent. So this theory, personally, after evaluating the cases also, I feel that along with retrograde menstruation, coelomic metaplasia, and distant metastasis, along with this, immune dysregulation is also one important factor to be kept in mind while treating the endometriosis. So this theory most promptly, I feel that it is a aptly suitable theory for treating. When you consider the treatment aspect, this theory will be more apt when comparative to the other theories. So this is the what my personal opinion after treating some of the conditions.
Thank you,
So
madam. It's a new insight for us that to view endometriosis as a ojo vyapat or a chronic Shoth-like condition. So now my question to our next panelist, Dr. Asokan. In the view of these elaborate discussions on theories of endometriosis, how do you see endometriosis with the endometriosis theories with the lens of Ayurveda?
Okay. So we have told earlier, madam has rightly told Ram that mithyacharena dastrena pradushtena artavena cha jayante bija doshacha. And the daiva factor unknown, where we cannot trace the cause. Exact etiological factors where we say it as unknown. So keeping those things in mind, here the Rajaswala Charya also comes under mithyachara, or the mithyahara vihara sevana during Rajaswala kala. In addition to that, we have to consider what we have left. I have left in the past question answer. That is, I have touched only Vata dosha and the Rasa dhatu and the Ardhavaha Srotas. So the second point which was kept by the next panelist was that Mamsa dhatu is also getting involved. So subsequently, if we consider, there is involvement of all the three doshas. So definitely the kapha, which is rasa varga, rasa is kapha varga and rasa is dushita. So the dushta rasa janita artava or pradushta artava is responsible for the manifestation. If it happen to be healthy, it has to have a healthy outflow tract. It should flow out by the action of vata in time. So that is regular cyclical pattern of expulsion of artava. So this is not happening. So let the theories and postulations vary, but our fundamental principles adheres to the factor that dosha dushya samurchana as the hetu for the vyadi, and dushyas unless and until the ardhava srotas is healthy. There is no question of development of, as madam has told rightly, that many women may have asymptomatic or unmanifested forms of retrograde menstruation, but no disease manifest. This is why is because of yatra sangha khavaigunya vyadi satropajayate. Ardhava srotas is making sthiti stapaka property there, as it is trying to make out the disease condition not to appear. In this juncture, I would like to go back to the theory of Prameha Nidana, wherein the Charakacharya has very elaborately and very simply has given one clue to understand Vyadi Shamatva and Vyadi Bala Virodhitva and Vikara Bhava and Abhava. So Vikara Bhava and Abhava, the quote says that I will read it for all of you. Iha khalu nidana dosha dushya visheshebhyo vikara vighata bhava abhava prativishesha bhavanti. The disease may manifest, disease may not manifest, even with the nidana and dosha dushya samurchana, and with dosha dushya samurchana not happening. Yada heto trayo nidana visheshaha parasparam nanu badnanti. They are not going hand in hand. There is some interruptions for the manifestation of endometriosis at some juncture. Dosha samurchana or samprapti or purarupa avastha, it is manifesting. Kala prakarshad abaliyamso athava anubadnanti. Taking some time, as in infertility cases, we can see taking some time they manifest. Kala prakarshad abaliyamso athava anubadnanti. Without much bala of the vyada, dosha and dushya, it is getting manifested with the subclinical symptoms. All the sites of extra abdominal or abdominal sites are not getting involved in every case of endometriosis because kala prakarshad abaliyamso athava anubhadnanti na tada vikara abhinirvrittihi. Then there may not be manifestation of full-fledged disease. Chiradva abhinirvartayanti. There may be late onset manifestation with the sequelae or udarka or uttarakalina vyadi. So there may be complications associated with, which madam has told that there may be anatomical defect of the structure of the uterus, as in retrograde uterus. That may also lead to the adhesions and all. So how to understand these complications in Ayurveda adhesions is, it is a kleda bahulya avastha and it is loss of dhatu kledata. So whenever there is a normal dhatu kledata and the srotas is, we can say that there is no dhatu in the srotas. Ardhavaha is not having any dhatu. No, definitely there are dhatus. Yacha vahanti, yacha vahanti. That which carry them is that particular dhatu only. So Mamsa Dhatu, Rasa Dhatu, everything is there. Along with that, Artha Srotas is also there. So there is Dhatu Kleda loss. So whenever there is a normalcy of Dhatu Kledata and normalcy of Shleshma in the Sharira, Prakritastu Balam Shleshma, Vikruto Mana Uchyate. There is no possibility of development of adhesions. Vikruto Mala Uchyate. Whenever the Kledavastha is Vikruta, or Dhatu Klinata or Dhatu Sneha is abnormal, there develops the adhesions. So this adhesions and the development of adhesions and the treatment of adhesions is in the purview of Dushita Shleshma and Rakta. Whenever there is a Rakta Shleshma Vikara or Paka as a result of Pitta. So these tridoshas are involved there and they are intermatting with each other in each phase so that the Dushita Vata can produce the Dushti and produce the disease. As Madam has told, Vishala Ma'am has told rightly that there may be Asrukdara as a Yonivapat Lakshana here because of excessive menorrhagia conditions. There may be manifestation of dysmenorrhea as in Udavarta and dyspareunia also as in Paripluta, Gramya Dharmaya Rubrusham, which is characteristic. Then infertility as in Mandhya Yonivapat, then adhesions and retroversion of the uterus as in Antarmukhi Yonivapat, and various other Kshetra Dushti may take place. Then Tanavova Bhavanti Ayathokta Sarvalingava. Tanavova Bhavanti. So endometriosis may not manifest with all full-fledged manifestation. Tanavo Bhavanti Ayathokta Sarvalingava Viparyaye Viparita iti Sarva Vikara Vigata Bhava Bhava Prativishesha Abhinivritti Hetum. So the disease may manifest or disease may not manifest. If it is manifesting as an endometriosis, there is Vikara Vigata Bhava is lacking. There is Vyadikshamatva is hampered. So Vyadibala Viroditvam, Vyadi Utpadaka Pratibhandakatvam. So our role, as Madam has very rightly told, Niramikarana, Ama as a cause, Madam told, for immunological dysfunction. Niramikarana is the line of treatment there. At the same time, we have to go with Dipana Pachana followed by Rasa Poshana by Rasayana Dravyas. So that the Prakrita Dhatu Kledata is achieved. Before that, we have to go with adhesiolysis. Maybe it is a Shastra Sadhya. If the patient seeking fertility, we may go with the Shastra Sadhya Chikitsa. Or if patient is not seeking fertility, family is completed, then we can go with the Aushadha Sadhya Chikitsa as adhesiolysis mechanism of interventions. As in Tridosha Shamaka, Tiktarasa, Deepana Pachana Dravyas, Kshirabasti Prayoga, etc. Lot many are going to come, yet to come. So keeping these things in mind, and I am breaking Khandana and Mandana. I am breaking the Khandana I am doing for Ashayapakarsha Gati of doshas here. That because I did not get an answer so far in the panel, I am saying that there is no such Ashayapakarsha Gati which is happening in the endometriosis. Let us discuss this later. Over to you. Hope I am clear with the explanation of Ayurvedic perspective. If I am lacking, kindly fill my lacunae by other panelists. I am requesting. So you can fill in the lacunae.
Thank you, sir. Thank you very much. Lots of insights are coming up because, as you have already said, that it's a this Vyadi does not exist in field of Ayurveda. So we are getting new perspectives. My question to our next
Sir Arun, I want to say the second line of that the Vikara Nama Akushalo. The subsequent shloka says that Sa eva kupito doshaha samuttana visheshataha sthanantara gataschaiva janayantyamayan bahun. So sthanantara gataschaiva janayantyamayan bahun kupito deshaha samuttana visheshataha. Here the samuttana vishesha of this vyadhi in endometriosis is that is itself is a vishesha. So
Yes.
Abhigata Visheshat Visheshaha. Abhigata, that is responding it is responding to the modern postulation of spreading from at the injured sites. So that also, and even at the injured sites, there may not be any occurrence of endometriosis until and unless the Dhatu Kledata and Dhatu Sneha is lost. If the Dhatu Sneha is lost, then only the foreign material will come and settle there. Our own tissue will come and settle there. Otherwise, the tissues will not settle at abnormal places. Sorry for interrupting.
Thank you, sir. So because we have to, hurry this discussion up because so many new things are coming up. So my next question to our next panelist is, Madam, let us focus on what are the hetus and samprapti of endometriosis in present day context. Over to you, ma'am. Dr. Jasmine.
Yes, sir. Thank you, Asokan sir, very, and Vishala ma'am, very, and Khairnar sir also, because he integrated the things of proper understanding of the disease, because like madam also said that retrospective understanding. Later on, we understand from the clinical features and the complications that how to understand this disease. In present context, as you asked, sir, how, and Vishala ma'am also, in the form of age group, that is, it may occur in the reproductive age group also. So it is not only the reproductive age group disorder. So one of the risk factor is age. So it may occur at any of the age group. Second risk factor from Ayurved point of view is that, which both of the panelists have also discussed, that the Vata dominance. So Vata Prakruti people, Vata Prakruti female will be more having susceptibility for this disease. And as sir said, Rajaswala Paricharya, non-observance of Rajaswala Paricharya, especially it is said that just prior to few days of menstruation, the Vata Anuloman should be proper. So if they are not following the Rajaswala Paricharya, even before, at the onset of menstruation and before the onset of menstruation, the Pratilom Gati of Vata. So this happens. And again, Sneha Dvesha. This is also one of the risk factor, or Hetu also you can say. Sneha Dvesha. Like sir also said, if Lishma, if it is there, if sneh is proper, then it won't cause adhesion. So it is very correctly mentioned that if female, if girl is having sneha dvesha, then she's not taking proper intake of sneha, this vat anuloman will not happen. So this becomes susceptible. As we said, khawai gunya, sroto dushti is there. Before that, khawai for the endometrium to implant. As madam said, every time there is retrograde menstruation, but it is not manifested. So this becomes the susceptible site in this particular risk factors. These are the hetus. Rajaswala Paricharya, again emphasizing again and again. Why? Because if we see from the modern point of view also, estrogen is at the lowest at the time of menstruation. Estrogen is a very good antioxidant. It reduces the inflammation. It reduces the shotha, but as it is at the lowest at the time of menstruation, that is why in Rajaswala Paricharya it is said to intake such kind of food to improve the antioxidant activity. But if it is not happening, so Rajaswala Paricharya, if it is not followed, it promotes the shotha, as Khairnar sir and madam says, cytokines and pro-inflammatory factors, and all these things will make it prone, make it susceptible again for the endometrium to implant and get this disease manifested in the form of clinical features later on. So this can be the hetu, this retrograde menstruation, udvamagata, what is said upon vayu and menstruation, and to the susceptible site it gets implanted. Remember that one of the factor which causes this endometriosis is angiogenesis also. And once it gets implanted, this endometrium gets implanted very correctly, vyadhi kshamatva, if it is less, dysfunctional immune system. That is why we get this more in the Vata Prakruti patients, dysfunctional immune system. So they will not be able to fight this, and the angiogenesis will continue at that implanted site where the endometriosis is there. And as estrogen dominance is there at that implanted site where the endometrium is there, whenever there is estrogen excess, it will continue to form the angiogenesis. So this way it forms. We have to integrate and understand in both ways. And very correctly, each and every panelist said that non-observance of the Rajaswala Paricharya in the form of diet and even in the form of physical exercises. Since long we have been telling that the sanitary napkin advertisements, which shows that during menstruation, just by wearing the sanitary pad, they can perform heavy exercises, which may again promote retrograde menstruation, again promote the udvamagata, this factor should be banned totally, because nowadays we get girls younger girls age group suffering from this condition, and that is why the reason is they are not following the proper regimen which has been mentioned in the Rajaswala Paricharya. So not only the faulty dietary habits but faulty vihar also. This also promotes this pathogenesis which is happening in the susceptible site of the adnexal structure and other structures. So this can be the hetu and samprapti from the integrated. I have taken the support of all the panelists and I have tried to summarize it how. So dysfunctional immune system in a Vata Prakriti patient with the Sneha Dvesha, okay, and sedentary life but excess physical activity at the time of menstruation. So all this can be the hetu, and samprapti already we have discussed. Dosha involvement, of course, there will be vata and pitta also, because shoth is there, and shleshma, which is dushta shleshma, as sir Ashokan sir said. So three dosha manifestation will be seen, and lakshana we already know that there will be excess of pain and everything which is discussed earlier. The nature of discharge, menstrual discharge, will be difficult. And tanu, ruksha, these all are the words which are mentioned and which is practically also seen in the patients which present with endometriosis. And even in Vagbhatta, the commentator Indu, he has mentioned gulma also in Vataj Yoni Vyapat. So at some places we see that our respected senior Vaidyas also correlate this as a Raktaj gulma also when it manifests in the ovarian endometrioma. So it can be taken as gulma also, and we know that the gulma chikitsa will be little bit different from here, because there we need to reduce the inflammation, because gulma shota samutta. So basic cause will be the inflammation also. So this is how my understanding is, and how retrospectively, as a madam also said, that after seeing the conditions, because we get 18 years of girls, 20 years of girls, 22 years of girls. And one more thing I want to add over here is psychological factors also, chinta and bhaya. This stress and anxiety, these two are also one of the most hetus, I will say, nidanas in getting this disease manifested, because that also aggravates the vata dysfunction and impaired immune response also. So sir, over to you. I hope I was able to convey the thing what is being asked.
Thank you, madam. Thank you so much, ma'am. This is worth note-taking class for endometriosis, and this is my belief that it is unprecedented that we have, our esteemed panelists have so many new perspectives on endometriosis, which are so good for all of us as students of Prasuti Tantra and Stero. So my next quick question, and I would like to have a very quick, sum up on what are the treatment principles and modalities in Ayurvedic parlance in the management of endometriosis? From Jasmine madam and Ashokan sir, if you can both, together answer this.
Madam, you can comment.
Hello, sir.
Yes,
Can you
ma'am.
repeat the last sentence?
So,
Arun sir?
ma'am, I would like you to highlight on the preventive and promotive and other principles of Ayurvedic principles of management of endometriosis.
Yes,
A very
yes.
quick sum up, ma'am.
Yes. Quickly, as I've explained priorly, that preventive aspect is, of course, all the panelists also agree on that observance of Rajaswala Paricharya should be promoted more and more in the younger girls. And if they start believing in that, then only later on in their life they will be following. Not only Rajaswala, but Garbhini Sutika, like Khairnar sir also says that during the pregnancy and later on there are other theories which promote this. So prevention is observance, and Vat, we have to Yach Vat Vikaranam, everywhere it is said. So Vat dominant should not be there. Sneha, of course, Sneha Dvesh is there in female, in all the female, because female is Sukumar and it will be there. But somehow we have to promote that Sneha should be taken, especially surrounding the menstruation, before menstruation and during that. So promotion of the healthy reproductive system in such a way can be done, and heavy exercises, of course, should be banned during the menstruation. Strictly, we have to ban such advertisements promoting physical activities during the menstruation, which aggravates the responses. And a treatment aspect, if we summarize in detail, then go to the Snehana Svedana Bastyadi Vataja, what is being explained there, and even Dashumula Siddhak Shirbasti as mentioned in the Gulma Chikitsa also. So what I basically considered as, of course, yes, Rukshana, Am is again an important factor, as Sir said, Am, Ajirna, because it also the environmental toxins. So that should be treated with the Agni Sandipana, immuno should be boosted, as ma'am also rightly said, and Shoth should be decreased in the form of while giving the basti. I will just summarize in this few words. I request Asokan sir to elaborate more on this, sir.
Yes. So coming to the chikitsa aspect, we have, as you told earlier, that Gulma we have to consider, because the Nidan of Gulma, it's exactly correlating with that. Tatra yada sa rutumati navaprasuta yonirogini bha. First criteria is rutumati. Second criteria assessment is navaprasuta. Third criteria is yonirogini bha. वातलाने आसेवते तदा अस्या वायुः प्रकुपितो योन्यां मुखम् अनुप्रविश्य आर्तवम् उपरुणद्धि. So here Margavarana is happening. So that is the Rakta Gulma or Gulma Chikitsa as Samanya Gulma Chikitsa, where it is being mentioned. In addition to Shofa and Gulma, sometimes we get the spreading of endometriosis, Visarpa Samprapti also. So we have to consider, keep in mind about the Visarpa Chikitsa also. So Visarpa Samprapti and its Chikitsa. And coming back to the treatment principle in brief up. So as you mentioned, it is Vata, and Vata has to be, Anulomana has to be achieved. In addition to that, the Amatva, in any conditions, Sama Nirama Lakshana of Vata also has to be considered, and Sama Nirama Lakshana of Shleshma and Pitta should also be kept in mind. Sroto Roda, Balaprabsha, Gaurava, Anila Mudata, Alasya, Apakti, Nishtiva, Malasanga, Aruchi, Klamaha, Lingam, Malanam, Samana. So these lakshanas he found. We are telling that this is the Chikitsa Sutra. Now we have to know how to diagnose Sama. So Sroto Roda, Balaprabsha, the lakshanas should be, an Ayurvedic physician should be able to diagnose Sroto Roda, Balaprabsha, the lakshanas. So Vyadi Bala and Roga Rogi Bala Pariksha should also be done, keeping in mind what mode of treatment. So what modality of treatment. Samanya is Amaharana, Dipana Pachana, Vatanalomana. That is the end of all treatments. And the Dvidham Chikitsitam, that is Shodhanam, Samshodhanam, Samyak Shodhanam, Samyak Shamanam. Samyak Shodhanam, Samyak Shamanam. So that is the invariably we have to do. Then Avarana Vata is also found to be having some role here. So keeping in that, Lingam Yanavrate Apane Snigdhair Anulomayet, Snigdhair Dravir Anulomayet. That is Vyanavrata Apana Vata Chikitsa. And in addition to whatever you have told, that is Amaharana, Ama Chikitsa, and Avarana Chikitsa, and Lakshanika Chikitsa we can do. So Avarana Hara Chikitsa second criteria is Apanavrate Vyane. So Sarvam Sangrahanam Matam. So Apanavrata Vyata Rajasascha Ativartanam. So here Rajasascha Ativartanam, menorrhagia is the manifestation of endometriosis association. Then with the pain. So we have to Sarvam Sangrahanam Matam. So here Sangrahi Dravya Prayoga is indicated, or the Chatush Prayoga for, or the four modality of treatment for Rakta Stambana, Sandhanam, Skandanam, Pachanam, and especially Dahanam is open abdominal surgery we can adopt, or Dahana is not directly applicable in case of Garbhashaya. Then Avrata Apana by Avrata Apana Vayudushti, Apana Avrate Sarvam Deepanam Grahi Veshajam. So Vatana Lomanam Yacha Pakvashaya Vishodhanam. Here comes the role of Basti and all. So the simplification is our aim of treatment. We can elaborate it to Niruha Basti, Anuvasana, and Yoga Basti, and Karma and Kala Basti also. So, but simplification rule says that it should be affordable to all the types of patients. So Matra Basti is the primary beneficiary agent. So Matra Basti with Vatanalomaka Dravyas, which is added with Saindava Lavana, which is Lavanopahita Sneha, Snehayanti Achirannaram. So Snehana can be achieved very quickly internally as well as through the rectal route, Pravicharana Bheda, of Acha and Vicharana aspect of Snehapana and Svedana, Agneya, Anagneya. Here we can select the Agneya Svedas accordingly, whatever is required. Then after that, Samyak Snigdha Svinnana, Samshodhanam by Rechana or Mala Rechanat. Then otherwise we can go with the Basti Shodhana, because Pakvashaya is the Adhishtana and Pakvashaya here it is the Sthanika Dosha is Vata. So Sthanika Dosha Chikitsa should be done, and then Agantuja, if it is not returning back to its normalcy by Sthanika Dosha Chikitsa, Pitta Shleshma Chikitsa also has to be done. So accordingly we can manage, and Basti itself is Ardha Chikitsa and it can effectively cure, but provided if the patient is having Nirami Karana requirement, that has to be adopted. So keeping these things in mind, we can go ahead, and later on, as Madam has told earlier itself, she has told Rasayana Chikitsa in Chikitsa also, Vishala ma'am. So that also can be adopted, Rasayana Chikitsa, with the Tikka Kshira Sarpikshi. So Tikka Kshira Basti can also be initially Lekhana followed by Ropana and Brahmana. So that in Basti schedule we can plan itself. And Uttar Basti is ultimate treatment. So whenever there is a retrograde menstruation theory, whether we should adopt Uttar Basti or not, after initial Vitra Stapana Shuddhebhyo Vidadyat Basti Muttara. After 2 or 3 Astapana Bastis, when the Koshta Anayana of the doshas have taken place, and from the Shakha Raktadayo Dhatavastvakcha, the Koshta Agamana of the doshas have taken place and the dosha Nirharana is achieved, then we can plan with Uttar Basti. So I think this much is very sufficient, very good, very much sufficient. Other is Lakshanika Chikitsa like Vedana, Harakashayapana, then Vatanulomaka, Agni Deepaka, Pachaka, and Churna Prayogas for Anulomana or Avipattikara, Avipatti Churna, etc. So these Uruksha Koshta and Snigdha Koshta we have to decide before selecting the drug of choice for Virechana also. And even Shiro Virechana is not the limitation for doing in endometriosis. We can even apply Shiro Virechana, Shodhananga Bhuta or Brahmananga Bhuta. So for the Shodhana, the Nasya can be done, or Shamana Nasya can also be done. And invariably it regulates the psychological factor onset of endometriosis. Mule Chitwa, the psychological factors of Pranavata is getting controlled by administration. Even the Shleshma Sthanagata Vikara are getting of Vata Vikara. Shleshma Sthanagata Vata Vikara are also getting alleviated by Nasya Prayoga, Samyak Nasya Prayoga. So that also, and never to ever to give in Rutukala, Rutur Vyapadyate, Nasyadana, Rutumatya, Nasyadana, Rutur Vyapadyate. So keep in mind about the menstrual phases of the patient, then we can adopt the Nasyadana.
Thank you, sir. Thank you so much. Now a quick sum up from our senior panelists, Dr. Premraj Khairnar and Vishala madam. How much integration is required? How rational, how safe, and how effective is the integrative treatment of endometriosis? Your experiences, your points of views.
Ma'am, please, you start.
Yeah. So basically, if we categorize into adolescent and reproductive age group, the most important point when integration comes without endometrioma, because the main objectives for the treatment is pain relief, fertility enhancement, and improving the quality of life. So if we consider these things, when the patient comes to you with the history of this endometriosis symptoms and signs, and of course, I'm not going because of shortage of time how to diagnose and all. The gold standard is laparoscopic investigation, but of course, for endometriomas, transvaginal ultrasound will be as effective as laparoscopy to diagnose. So when endometrioma evidence is there, my practical experience is when it crosses 3 centimeters, no medical management will help in treating endometrioma. This is, of course, my personal experience with my patients. So in such conditions, first what we need to do is we have to get it removed, the endometrioma. So provided when there is a fertility is expected in younger age group, we have to go for ablation and drainage of the endometrial cyst. When the family is completed, directly endometrial cyst removal can be done through laparoscopy. followed by Ayurvedic treatment. But when it is an adolescent, of course, when the adolescent is presenting with multiple endometriomas of bigger size, the same treatment has to be adopted initially to treat with either with laparoscopic removal of the endometrioma or keeping the patient on some testosterone derivatives initially to reduce the size of the endometrioma. Then we can intervene with the Ayurvedic treatment. So Ashokan sir has rightly said, any treatment will start with Amapachana. Dipanpachana is the prime factors we have to maintain, because it is to prepare the body for the Shodhana Chikitsa. And also for any Rasayana treatment we wanted to adopt, unless and until Dipanpachana is there, we cannot make the use of Rasayana Chikitsa. So increasing Vyadik Kshamatva is most important concept of Rasayana. And one more important treatment, we can reduce the size of endometrioma as well, recurrence of the endometrioma even after the laparoscopic treatment. Virechana we can give. So Virechana reduces the effect of the estrogens because constipation increases the level of estrogens, which can be a contributing factor for the development of endometriosis. So Prakriti assessment, when we wanted to adopt what type of treatment, what type of Shodhana Chikitsa we wanted to adopt in the treatment of the patient, Prakriti assessment is very important, followed by Amapachana at least for 15 days. So less than 15 days Amapachana, the result will not be effective. Then followed by Virechana, and both the speakers, Dr. Jasmine and Dr. Ashokan sir, has rightly mentioned about the Yoga Basti or any Kashaya Basti. So mainly Dashamula Eranda will give better result comparative to any other Kashaya Bastis, followed by, as a purpose of Rasayana, Yapan Basti. So Mustad Yapan Basti or Tikta Kshira Basti is also effective to treat the condition. And also adding one good Rasayana finally. So after this Rasayana Basti, internally any Rasayana, like it could be a Shatavari, Ashwagandha, simple Amlaki will also do the purpose. So most probably we can also help the patient by giving a Nitya Virechana, that is daily Anuloma. Most common drug we adopt for this is Sukumara Kashaya. So it will give a very good result for the Nitya Virechana purpose, and it will be also helpful in the Shodhana, Nitya Shodhana. And these all conditions provided we get rid of the endometrioma. But provided endometrioma is less than 4 centimeter, we can directly start the Shodhana Chikitsa. So when we consider the family completed patient, then the treatment again will change. Of course, the integration will be in some of the patients who completed family. And the main purpose is quality of life improvement by the pain relief, because severe rectal tenesmus will be seen in grade 5 endometriosis. So in such conditions, what we can do is, we can give an intrauterine device like Mirena, which is a low-dose progesterone device, combined with the Kashaya Basti. So this will help in giving the pain relief and also improving the quality of life in the patient who has completed the family. There is no issue of fertility, and it is after 35 or 40 years, we can adopt this treatment. So these are some of the important integrative aspects. And one more preventive point I wanted to mention here is when there is a premature labor. So that premature labor, if it is a female baby, that is a high risk factor for development of the endometriosis. And there is a BMI more than 30, prematurity, and early onset of menarche. So always we have to counsel the parents whenever we come across such conditions to go for appropriate periodical Shodhana to prevent the development of the endometriosis. And also we can adopt as a part of preconception care to advise in future, if the born female, if the born baby is a female, how to maintain. If the mother is advised, automatically it can be adopted to the female born baby with the early menarche and low birth weight, particularly when these two incidences are there, there is always a probability of development of the endometriosis. So in such conditions, what Rajaswala Paricharya has to be maintained, what Midhyahara Vihara has to be avoided, you can advise even as a part of preconception care, so that this can help in preventing the endometriosis. So due to lack of time, and also to give opportunity to speak about some more integrated management to Premraj sir, I'm handing over to Dr. Premraj.
Thank you, ma'am. Most of the part of treatment is covered by all expert panelists. I will just touch few points. Basically, we look at this treatment of endometriosis in two parts. First one is preventive and second one is curative. So in preventive, there are many students or PG scholars I can see, they should focus on the point that there are some important things that you should follow every time. First and foremost thing, to avoid the tubal patency test immediate after any curettage or immediate after the stoppage of menstrual flow. So you should not immediate go for hysterosalpingography or tubal patency test like SAG, sonosalpingography. You should avoid it. Second thing, one must, those ladies who are having family history or this thing of endometriosis, having her mother or grandmother having endometriosis, these ladies should be encouraged not to delay their first pregnancy. That is again a very important part. And third, again one important part, what we see in our day-to-day OPD practice, we should avoid forcible pelvic examination or PV examination immediate after menstrual flow is stopped or during menstruation. One should not perform. So these are basic tips which are preventive. Again, I will talk some important on Nidana Parivarjana. Each lady having endometriosis is having particular hetus, and we have to find out that hetus. And day one, you should immediately address her issues of Nidana Parivarjana, and that helps a lot for the disease progression manner. So these are the things for preventive. When it comes to curative, we have some objectives. As madam rightly said, we have the aim to suppress the symptoms or the symptomatic relief, what we want to say. If the patient is infertile, then fertility preservation is again one important thing. Then most of the times we should think of her betterment of her life, or what we can say easiness in her day-to-day course, that is lifestyle. So all these things should be considered. Now when it comes to actual treatment, we should think that whether the patient is fertility expecting or fertility should be preserved, or she is having children and the endometriosis is in fetal stage. So all these things should be considered. For those patients who are having fertility issue, the treatment is very, very classical, and you have to opt it very wisely, because when you opt hormonal treatments, then hormonal treatments always give the fertility treatment in a delay manner, because initially you will try to control the disease with hormones like norethistérone or levonorgestrel, LNG, IUD. All these options are there, but the fertility or pregnancy will be delayed. But that has no choice. You have to go for that. Here comes Ayurveda, when Ayurveda has a great perspective to treat such conditions. Suppose such kind of patients are there, we need to address the issue whether the endometriosis is, we can say, Vyakta Avastha is there or Avyakta Avastha is there. There are certain ladies who are having initial phase of endometriosis in the form of just fluid in pouch of Douglas, and this pouch of Douglas fluid is because of the reactionary, you can say reactionary response of the tissues, and it has many cytokines or pro-inflammatory markers. When it is there, then there is lack of tubal function and pregnancy gets delayed. So in that case, you have to treat it very wisely. The inflammation should be corrected with Ayurveda treatments or with modern medicine as well. Then when it comes to non-fertility, or when the the disease in Vyakta Avastha, like when there are endometriomas or adenomyomas, then you have to treat it very nicely. First thing is, most of the patients should undergo MRI when the basic ultrasound suggests you about endometrioma and adenomyoma. Why MRI? Because you need a very deeper speculation to take out the involvement of adjacent organs like bladder, bowel, whether the bladder peritoneum or bowel peritoneum is involved, whether the momentum is involved or not, what the disease has progressed up to the vault of vagina, or what the adenomyoma has extensions or its mapping of adenomyoma. All these things are really important, and they can be very well illustrated through an MRI, so that we can plan the laparoscopy surgery very better. So diagnosis is also very important, and diagnosis will lead you to correct planning of surgery. Third and important thing, those patients who are not desiring fertility, but they are having endometriosis in moderate or severe conditions, there are two groups. One is like younger age group, and one is elder age group. Nowadays, we can see many younger females who are having endometriosis in just childhood of 16, 17, 18 years. In such patients, you are having very limited options. The patient is not easily ready to undergo surgery. In that case, Ayurveda helps a lot. These patients do come in emergency as well in the morning, early mornings, that doctor, we are having severe pain which is not responding to NSAIDs, no IV paracetamol, no diclofenac. These pains are not responding to potential analgesics. Here comes the Ayurveda help, where we can give immediate matra basti of Mahatiktaka Gruta, and like 30 ml of Mahatiktaka Gruta and 20 ml of Eranda Tela, or you can say Tila Tela as well. So this is combination of Gruta and Tela, which is very effective. And believe me, we are day in, day out using this protocol. Within minutes, the pain goes down very nicely and the patient gets relieved. But this is highly symptomatic till it is having good potential to control this patient on further longer treatment. Now, when the disease is in Vyakta Avastha, then we need to plan a better Ayurveda treatment as well. I will not talk on the hormones because everybody knows. The Ayurveda treatment will focus on immediate starting of Yoga Basti. The Yoga Basti with Dashamula or Eranda Mula, the Sneha Basti will definitely help. As Madam said, Rajapan Basti or Yapan Basti, Madhu Tailik Basti, they all have very good potential effects to control the disease. Then the further part comes regarding Uttar Basti. We always promote the patient or encourage the patient to take Uttar Basti, but as Asokan sir very rightly said, we do not give it very immediate. We always follow 1 or 2 cycles of Yoga Basti, and then we subject the patient for Uttar Basti. Now here in Uttar Basti helps very nicely in the cases of adenomyomas or adenomyosis, where the patient is having globular adenomyosis, and Uttar Basti helps to stop the progression of the disease. Even it reduces the symptoms of adenomyosis. There are 3 or 4 cases where we have got reduction in size of adenomyoma, and as we always say that the aim should be making the lesion quiescent, whether it may be endometrioma, whether it may be adenomyoma, or whether maybe with the simple patches of foci. We should make the abnormal or ectopic endometrium quiescent. So making quiescent has better option with Yoga Basti, Uttar Basti, and even we can give some Paniya Kshara. Paniya Kshara is having great role for that. In certain conditions, depending upon the Dosha Dushya Sammurchana and depending upon the Dhatu Gata Avastha, you can select Sneha Pana as well. Clear Sneha Pana of 20 ml per day with Mahatiktaka Gruta helps a lot in such patients. So treatments are not that complex. There are many patients who come with severe menorrhagia along with adenomyosis. Okay, so this is the age group which may not interested to undergo hysterectomy. Now there are very limited options with modern medicine. Sometimes, as Madam said, they will put some Mirena like levonorgestrel IUD, LNG IUD, they will put. But believe me, I have 4 to 5 cases which already had been inserted LNG IUD and still the ladies were having severe menorrhagia. In that cases, we need to took out that LNG. We didn't took it out initially. We added some oral progestins initially, but when we observed that the progestins are not working with a high dose along with the local LNG IUD, then we took it out and we managed these cases either with surgical options or with good Ayurveda treatments. So my observation is Ayurveda definitely works better on these hormone therapies, first and foremost thing. And no doubt Nidan Parivarjana will definitely help. So there are a lot of things what we can talk about, but Deepana Pachana is again really important. As Madam and Ashokan sir said, Rasayan Chikitsa is again very important. The most important thing is Rajaswala Paricharya observation, as Jasmine Madam is a very exuberant speaker on this topic. So all these things matters a lot. In today's era, this disease is progressing very fastly. Endometriosis, very popularly called as cousin of malignancy or cancer. Definitely it will not kill the patient, but it will give the pain or misery to the patient, which is not less than a cancer patient. So we should always focus on these symptoms of the patient. Good surgery is very, very important. There are expert surgeons across India, length and breadth. There are good laparoscopic surgeons. Laparoscopy is the modality of treatment which helps to take out most of the lesions which are expressed or what we can see by vision. These lesions can be taken out. Again, the question remains about recurrence. When these lesions are having subsequent recurrences after surgeries, then Ayurveda has again a great role, and out of all these treatment protocols, we can proceed ahead. So in my view, Ayurveda has great potential to address difficult cases as well. So I will conclude my view with this statement. Thank you so much.
Thank you very much, sir. Thank you for your valuable insights on the management of endometriosis through integrative approaches, where to use, when to use. Thank you very much, sir. Now, I would like to request our convener, co-convener Sunita Joshi madam, to please sum up this panel discussion and give your words of wisdom. Madam.
Once again, good evening to all, and it's a great topic like Dr. Arun has taken up, because as Khairnar sir was telling that day to day we are seeing number of endometriotic cases, and with repeated surgeries also. And this is a thing where we have to integrate, because modern medicine doesn't have the right treatment for this, because here we see number of endometriosis CMEs are going on, and what they are saying is we should not ignore the dysmenorrhea from the 13 years of age, or from the menarche who are having the menarche, severe dysmenorrhea from the menarche. They have to be elaborately seen and all, even advising MRI also. So in that condition, so we have to take a step into that, and we have to go integratedly, so that, see, the main aim of the Ayurveda is Swasthasya Swasarakshanam and Aturasya Roga Prashamanam. So we have to do that. For that, we have to take up even from the association of our cargo also to go to the public, and we have to say the Dinacharya, Ritacharya, and all along with this Rajaswala Paricharya, which has a great role. And at the same time, as all the panelists, they have touched all the nook and corner of the subject, and really I'm very happy to choose the right panelist for this subject. And this exactly the Yoni Rogas Nidana, as Dr. Ashokan has started with the Nidana and the role of Vayu in this disease, along with the Vata, the role of Kapha and Pitta also. Rightly, Dr. Ashokan and Dr. Jasmine, both of them, they have detailedly explained about the even Prameha Nidana also, Prameha Chikitsa also. Dr. Asokan has spoke on this, and even the Dr. Khairnar has started this with coelomic theory and metaplasia, and even delivering methods of delivery. Exactly, nowadays people are going for non-episiotomy delivery. All the, like, we have a hospital here where the thousands of deliveries they will conduct monthly. They are adopting the normal delivery without episiotomy as far as possible. So so we are coming back to the original thing, so thereby preventing this type of problems. So, and this Jasmine has like spoke about the Rajaswala Paricharya, observing, and antenatal care as well, because has who has the antenatal care properly, and who go through this and having a good weight of the baby and the fully matured baby, we can prevent. The prevention is first aspect, and after that the treatment comes. So here observing the Rajaswala Paricharya, and at the same time our Garbhini Paricharya also. And about the Mamsa Dhatu, the involvement of Dhatus also, we have discussed here. And according to the Chikitsa, if we take like Chikitsa, particularly Vata Prashamana Chikitsa, because Anulomanam, and that has to be done as a swastha also. As a swastha also, from the beginning we have to adopt. So in olden days we used to get this castor oil or our Gandharva Hasta. So periodically they used to give for the all children. Or even adults, whole family used to take repeatedly, like once in 3 months, like that. So that is Virachanam they used to do. So we have forgotten all our regular habits. So by following that, and our we are also doing the same Tiktaka Gritas we are giving, and Sukumara Kashaya also has got great role, and particularly Dashamula Kashaya Vasti, the Asthapana Vasti with Dashamula Kashaya, and with the Anuvasana Vasti with our according to the Prakriti we are taking. So we are getting good results, and particularly for the sake of quality of life, we may not give 100% result, but quality of life, the pain, the misery, definitely addressed with our treatment. And hope we have to do more research in this, and to prevent our chocolates and all. So particularly fertility aspect, we have to do more research on this subject, and hope that further also we will take up this, and we may give good relief for the society. And I thank all the panelists for their great insights in this topic. And I thank our Sambhasha Parishad, Stri Roga Sambhasha Parishad, for taking up all good quality based discussions. And thank you, Dr. Arun, for giving me this opportunity. Thank you, one and all.
Thank you. I am extremely grateful for all the panelists. For me, this is a masterclass. It's an eye-opening session with so many perspectives of endometriosis, and so much to learn. But this journey has to continue, and I would request all the panelists to please stay with us in this 3-month journey, so that we can consolidate this knowledge which we have garnered together. Thank you very much. And at this juncture, I would like to extend my thanks to my co-coordinator, Vaidya Matangi Pandya. She supported me in designing this Sambhasha and this panel discussion, the questions, and to contact all the panelists. Thank you, Vaidya Matangi madam. And I extend my gratitude to our esteemed Vishwa Ayurved Parishad platform, which always motivate us to come up with novel ideas, and to to continue the flow of this Gyana Ganga. And I would like to thank all the listeners, viewers who have been with us for this 2 hours panel discussion. Thank you one and all. And now I would like to request everyone in this discussion to please turn on your camera so that we can have a group photo.
I joined with mobile, sir, at last.
No, thank you, ma'am. Thank you so much. Thank you so
Just
much.
Just to see. Thank you,
Sunita
sir.
Joshi, ma'am,
I
please, if
learned
you
a
can turn
lot
on
from
your
my
camera.
co-panelists also. I learned a lot today from all my co-panelists, my seniors. Thank you so much.
Thank you, ma'am.
Thank you, Matangi dear.
Sunita Joshi, ma'am, can you please turn on your camera, ma'am? Thank you, all the seniors
Namaste, ma'am.
making this first episode of our panel discussion on endometriosis a great success. Thank you to all of you. Thank you very much.
Thank you.
Namaste. Thank you,
Thank
Vishala
you
ma'am.
and good
Thank
night.
you, Khairnar sir. Thank you,
Thank you.
Asokan sir. Thank you so much.
Thank you,
Thank you,
ma'am.
Sunita
Thank you so
ma'am.
much.
Thank you.
Yeah, thank you, everyone.
Arun sir,
Ashokan
thank you
sir,
so much.
Dr. Vishala, and Dr. Khairnar, Dr. Arun, Dr. Matangi, how are you?
Thank you, ma'am.
Fine, ma'am. Namaste, ma'am.
Namaste.
Thank you, all the
Thank
organizing
you for
committee, Dr. Arun Gupta ji, Dr. Sunita Joshi madam, all the co-panelists, Dr. Premraj sir, Ashokan sir, Dr. Jasmine, Dr. Matangi.
Thank you, ma'am.
Thank you. Thank you
Thank
for
you,
this
ma'am. Thank you so much.
opportunity.
Thank you, ma'am.
Thank you, Arun sir.
Thank you,
Thank you,
Sunita Joshi, ma'am.
Now, I
Thank
request
you,
you all
Dr.
to
Arun,
please, to please stay with us in these 3 months which we have planned.
Yeah.
Sure. We
It's a
all
great
would like
initiative.
to love there on this platform for next 3 months, certainly.
Thank you.
Thank you,
It's a
Arun.
great learning experience.
Sir. Arun sir, thank you for smooth handling.
Arun sir left me.
Sir has left.
Sir is left.
Sir
Okay. Thank you. Good night,
left.
everyone.
Thank you,
Okay.
everyone. Thank you,
Good
everyone.
night.
Good night. Good night.